So the first presenter is going to come from Sysmex and is going to discuss, is it Sysmex? Sysmex. Okay. Sysmex, new approaches to malaria diagnosis and management. Are you Dr. Angela? Please, may you please come forward and take over.
Okay, so I'm going to assume somebody's going to change the slides as we go along. Afternoon, everybody, and thank you very much for joining us this afternoon. I know that it's a little bit late in the afternoon and we're all getting tired, but yeah, I'm short. So. Right, so we all know that malaria is still a very important topic, especially for East Africa. And the WHO has very specific targets in place for us to reduce mortality rates, to reduce infection rates, and also there are certain areas that are marked for eradication. Now, when we talk about this, unfortunately, we were doing very good. We were getting along and we were improving on those stats, and unfortunately, during the COVID pandemic, it declined a little bit and we regressed a bit, and that's for various reasons. Our focus was on different pandemic at the time, and also a lot of the money was funneled towards that. But we need to now get to the point where we are progressing again against the fight. And we are starting to see a few more challenges arising when it comes to the pandemic, one of which is gene deletions. As far as diagnostics is concerned, we've got the HRP2 and 3 deletion that is becoming more prevalent, and unfortunately that is affecting the diagnostics spectrum of being able to accurately diagnose patients. And we are also starting to see an increase of the Anopheles stephensi mosquito, which is more adapted to urban areas. So in areas like Dar es Salaam and Nairobi in Kenya, for example, we are starting to see more and more of the Anopheles stephensi vector being present, and unfortunately that means that we're at risk of getting an increase of malaria in the areas where we don't normally see it. So we can move on to the next slide. When we're doing malaria diagnostics, we need to look at various areas for specific reasons, right? So if we're going to look at gametocytes, for example, this is for us to be able to look at eradication purposes, because this is how it is transmitted to the mosquito and then onto the next human being, for example. And this can be in asymptomatic individuals, so individuals that have got high resistance sort of rates, but they still have gametocytes circulating. Then we going to look at hypnozoites, right? This is the liver dormant parasites that are present, and we need to be able to detect this for the speciation, at least for correct treatment or additional treatments that is needed for us to clear those dormant parasites. And then we want to have a look at the merozoites, the ring forms, etc. And this is for clinical diagnoses and the life cycle of exactly where the malaria parasites are. And we can move on. So Sysmex is known for hematology. We're the leaders in the market for hematology. So we would normally use a red laser on our analyzers to do the CBC and 5-part diff that we have on all of our analyzers and the additional applications that we do. However, when it came to specifically looking at malaria, we did a lot of research with the red laser, and we realized that the violet laser was much more sensitive, and using a very specific fluorescent dye that the parasite takes up, we are able to then detect the malaria parasite, regardless of the species. We can move on. So this is our analyzer, our hematology analyzer, the XN31. And it has the added value of being able to do your complete blood count in addition to being able to do malaria diagnostics and speciation. Now, it's an automated analyzer, so it's able to do 55 samples per hour, which means that you are going to get your malaria result in under a minute. So it can be done in automated settings. So if it's even just every patient's blood is running through the machine for unsuspected malaria, or whether or not it's a stat sample for somebody who you are looking at as suspected malaria. The advantage of having that CBC is all of your red blood cell indices for anemia and hemoglobin concentrations, for example, as this is something that needs to be addressed immediately with individuals with severe parasitemia. We can move on. So these are just your actual parameters that you are going to get, your diagnostic parameters. So as I explained, you get your malaria-infected red blood cells, both an absolute count and a percentage of the entire red blood cell population. And it gives you your red blood cell indices that are interested. Move on. We then have also research parameter settings on the next slide. This is now when we are having a look at the actual life stages of the parasite and where we are able to start flagging for the various species based on gametocyte presentation, etc. So gametocytes, if we're looking at eradication, become really, really important, and unfortunately rapid diagnostics, etc., are unable to detect this and wouldn't come up as necessarily a positive on current systems that are available. We can move forward. This is how it looks on our analyzer and how we are able to differentiate between different species and infections. So in the first quadrant, you will see that that's a normal sample. There are no malaria-infected red blood cells in that sample. In the middle is a falciparum infection. You can see two very distinct populations of infected red blood cells. The first is indicating that it is one parasite within a red blood cell, and the second population is when more than one parasite is found within the red blood cell. And if you look at the very far left-hand side, this is a vivax infection. You can see that your gametocyte clouds are somewhat different from falciparum, and also you, in general, will only get a single parasite infecting a red blood cell at that time. We can move on. This is how the machine basically flags for different species and how it is able to do that. So instead of looking at this in a 2D form, the analyzer is having a look at it basically in 4D. It's having a look at where those clouds of cell populations are sitting, the size of the clouds, etc. And based on that information, it's able to flag for the speciation of the parasite. Next slide. We're also able to use the analyzer for clinical case tracking, right? So you have an individual who comes in and is put on an antibiotic for the parasitemia, and you need to check whether or not this is working. So in the first diagram, you can see the untreated patient where you have a very high level of parasitemia. And then on day 2 of testing the patient, once the treatment has started, you can see a massive reduction in the actual parasitemia load. And then finally on day 3, it is below the detection level of the analyzer. And so you can see that your treatment is working. However, the reverse can happen, and you can see that your parasitemia level is increasing, which means that your current treatment that you are giving your patient is incorrect. And so you are able to adjust the treatment as needed for that patient. Next slide. Now, we've done quite a few studies for various sort of industries or areas for treatment, and one of them is a blood bank, to being able to screen the blood that's being given or being donated to a blood bank. Unfortunately, it's a bit of a balancing act. We need to be able to have safe blood supply, but we also need to have sufficient blood supply. And in certain areas, we cannot discard blood purely because it is infected with malaria. We also shouldn't be just prophylactically treating everybody in high endemic zones with anti-malarials, because we are now going to start facing AMR issues. And so we need to find the correct balance. So the next slide shows you that we did a study at the Malawi Blood Transfusion Services. And basically what we did is we compared the analyzer, the XN31, against the standard microscopy that was used by the Malawi Blood Bank to test all blood bags. And overall, there was more than 5,000 blood bags tested. The XN31 came up with a positivity rate of 11.7%, I think. On the next slide, please. 11.7%, 11.6%, and the standard microscopy came in at 6.5%. Unfortunately, that meant that there was almost 300 of those blood bags were actually malaria positive and transfused to probably your most intensive care patients that required blood that wasn't infected, or the patients didn't receive prophylactic treatment before getting those blood bags. And our sensitivity and specificity outdid the routine microscopy. If there was discrepancies between the routine microscopist and the XN31, it was sent to a WHO certified expert microscopist to review those slides. And from that, we then went to PCR if there were still discrepancies. We then utilized this data on the next slide that to see whether or not it could be used for surveillance purposes, and basically we came up to the point that, that's not the right one, but I'll get to that now, that you could use that data that was collected in order to for surveillance purposes. And then lastly, at the moment, the analyzer is CE-IVD marked for venous EDTA blood. However, we are aware of the fact that capillary blood is sometimes the only option. We compared capillary blood with venous connected blood, as well as storage of 24 hours and storage conditions, and it was found that there was no difference between the results of the XN31 in either capillary or venous blood, as well as the storage conditions over 24 hours if you are getting samples in from outskirting areas. And that concludes the presentation. Our in-country partners are SciEx. They have a booth here, and you can reach out to them at any stage, and I'm also available afterwards if there's any questions. Thank you very much.
Yes, your time was up some times ago, but however, if there is any burning question, because this is malaria, we cannot just leave it as it is. Any burning question? Okay, you prefer to ask her just after this session. I think she's available for answers. The next session is from SHDEPHA Plus, a beacon of hope in Tanzania healthcare. I know the one who is presenting is Rabia, and not the one you see in the picture there. So she's going to tell us her name and what she'll be presenting. Karibu.
Yeah, so good evening, everyone, and thank you so much for joining this session. I'm presenting on behalf of my colleague, Venance Mzuka, who is the Executive Director of SHDEPHA Plus. So SHDEPHA was interested in this forum of who is who when it comes to provision of healthcare services in Tanzania. So can we go to the next slide, please? Yeah, so SHDEPHA is just an abbreviation which stands for Service Health and Development for People Living Positively with HIV/AIDS. And it was founded since 1994, November, and currently it operates in 11 regions of Tanzania, as we can see on the shaded blue map. So we are here legally as national NGO operating specifically in Tanzania mainland. We have key personnel or staffs who are supporting the implementation of different programs which are being supported by different donors, development donors, and the other implementing partners who are implementing within Tanzania. So what are we visioned at? So we are visioned in ensuring that the communities which we serve is free from poverty, hunger, disease, but also the community members enjoys the good quality of standard well-being and also social well-being. But we target by empowering the marginalized people, like the women who are the adolescent girls and young women, people at a high risk, like the fisher folks when it comes to TB, many at a high risk, but also elderly and the children. Next, please. Yeah, so where do we focus? What is our focus? As we can see, we focus in provision of health and social services. When it comes to health, now that is the silly disease like HIV, tuberculosis, malaria, and for economic empowerment and gender, GBV issues, which is being provided to the communities whom we serve, and education. So we have different programs whenever we mobilize resources, whenever we implement. This is the target where we are focusing at. But we don't just do it alone, as I earlier said. We do it by receiving funds from the donors like PEPFAR, USAID, CDC, but also other implementing partners who are implementing within the country. Like currently now, we have a program supported by AMREF Tanzania. We have programs supported by ICAP, FHI 360, but not only those, we also have others who are supported by other civil society organizations like Foundation for Civil Society. So different programs are being implemented within the region like USAID EPIC project, through FHI, USAID Afya Shirikishi, through AMREF Tanzania, the Global Fund through AMREF as sub-recipients, but also USAID Orphans and Vulnerable Children Program, which is implemented in Shinyanga, Morogoro, and Geita regions supported by Impact Tanzania and ELCT. Next, please. Yeah, so looking at our strategic objectives, strategic plans, so far during 2019 to 2016, we have achieved a number of key results, especially when it comes to HIV prevention services, because we do prevention services like creating demand for the services to the targeted audience, doing the screening, but also engaging the healthcare providers when it comes to HIV testing services. When it comes to TB prevention also, SHDEPHA is doing a lot by engaging the community health workers who provide also health education for TB, symptom screening, identifying also presumptive TB cases, sputum collection, and at the end, ensuring that the people who have been confirmed with tuberculosis are being linked to treatment, but also adhere to their treatment. And when it comes to sexual and reproductive health, we do sensitization in terms of screening by ensuring that the adolescent girls and young women are following proper measures to protect themselves from like child dispersing, as we can see. That's also combined with the maternal and newborn, so those are the areas of achievement. Next, please. Yeah, so we also have activities related to youth empowerment. So we equip youth who are the adolescent girls and young women, but out of school, by providing them or linking them or like orienting them on how they can strengthen their economic well-being by like training them to join the village saving and lending groups, but also taking them, building their capacity through VETA, scholarships, and other apprenticeship programs. And in that way, they have improved their lifestyle, but also reducing the risk of like getting HIV, new HIV infection, in a way that they can do the self-reliance. When it comes to gender-based violence, we work closely with the policy gender desk, but also the health facilities, where after we screen and identify people who have like experienced with GBV, then they are being linked to services of their choice at respective institution, but also they remain in support with the organization. We also have programs related to education, as I said. So through the programs which currently we have, but also for the past programs which we implemented, we support children in ensuring that they do like, they increase high passing rate in mathematics, science and mathematics, but also in providing some educational subsidies, especially to these families of where children who are HIV positive, they come from the poor family, and this has mostly been done through the orphans and vulnerable projects like Achieve and the Kizazi Hodari. So now, what is the impact which SHDEPHA is making in the country? And we can see some transformational change and empowerment that SHDEPHA, through its work, through its credible work done in the country. So we can see These are some of the clients acknowledging the services to which SHDEPHA is offering in the country. So looking here, this is Kabula Homa. So for her, she's 67 years old. And now she was like reflecting herself on how she suffered of tuberculosis. And now I quote her, I'm extremely grateful for the TB mobile van because we also use the TB clinics to reach individuals in TB case findings. So without it, I would have remained unaware of my TB diagnosis, suffering in silence. The project has not only saved my life, but also empowered me to provide and care for my family, allowing me to lead a healthy life once again. So these are some of the acknowledgements, the testaments from the community. It's because of the work which SHDEPHA is doing. But also we can also see Helena also says, I have fully recovered from TB and now actively engaged in farming, and by then, before she was reached by the services to which SHDEPHA is offering, she could not do anything, and she appreciates the great work which is done by the organization and collaboratively with the community health workers. Next, please. Yeah, so other things we can see from Veronica, and because we work with influential leaders, like the church people, when it comes to like as emerging disease like the COVID-19, so due to the stigma issues, the hesitance in accessing the vaccine uptake, we can also see changes on how they are advocates, they are game changer in influencing other community members to access the services. Next, please. Yeah, so we are looking forward to expand the services which we provide here in Tanzania, scaling up the successful innovations which we are making in the country, but also building the networking and partnership with you and in fostering the issue of collaboration. So as you can see, this is all about SHDEPHA, and it's because we want to form a strong networking, to form a strong partnership with you, and we are open, and I trust that through this beginning, we can create a healthier world in Tanzania towards the universal health coverage so that we can end TB, malaria, and HIV. Thank you so much, and we always have a saying at our organization, when I say SHDEPHA Plus, so SHDEPHA team, could you stand? SHDEPHA Plus, together we are hope and life. Yeah, so thank you so much.
I know we have questions, but because of time, kindly see her after the coming sessions. NMB, please. NMB, they're going to talk about asset financing, and your presentation is already loaded. And I know you are representing someone. Okay, kindly introduce yourself and start right away.
Good evening. My name is Christopher Mgani. I'm here on behalf of our head of department at NMB, Mr. Alex Mgeni. So just in brief, I would like to just take you through what NMB can provide for the people in the Health Summit, but also what is their capabilities overall. So I'm sure all of you are all aware with NMB in our support for the MSME segment. Now in the MSME segment, that includes the health sectors as well as many other sectors, and we have been participating in the health sector for quite some time. So this is just a snapshot of where we are as a bank. Next slide, please. Yeah, so basically our play in the MSME segment, we've been successful due to our outreach in every region, but district as well, but also on the capabilities of offering financial services in those particular sectors, as you can see there. And we have been quite successful on the SMEs and MSCs, giving them various types of products in the digital space, as well as in the offering digital and financial solutions. Next slide, please. Now, I just want to talk about the element of asset financing as how this will be beneficial in the health sector. Now, in the asset financing, what we normally look at is what the asset we intend to finance for those particular institutions. So, for example, you have ambulances, you have a number of machines in the hospitals, MRIs, X-ray machines, as probably beds and so on and so forth. So the number one advantage is that this process is quite easy in accessing that loan. As far as the collateral is concerned, the same machine or asset becomes the collateral. You do be provided with an insurance, which covers the comprehensive part, as well as the facility tenure goes up to 5 years. So we have been doing this for some of the small health institutions, as well as few large health institutions. Now, next slide, please. Yes, this is just an overview of what the parameters are. As you can see from the top, for a single item can go up to 3 billion a shilling. The targeted sectors, as mentioned, as you are aware here, it's the health sectors. These are provided in 2 currencies, because these are the ones that are available. However, we do finance in other currencies as well. As far as the machinery itself, we do finance that's a brand new, as well as the reconditioned, should that happen. On the interest rate side, don't be alarmed because this is subject to discussion and what that machinery will be used for. As far as collateral, as mentioned earlier, the same machinery will be collateral. And as far as tenor, you can go up to 5 years. Age of machinery, it does tend to vary. However, we do accept to the maximum of 5 years. I mentioned about comprehensive insurance. For movable machines, the likes of ambulance, we do require for you to install a tracking device. So that's on the asset financing. However, we do offer other available finances in the loans, investments, and other likes. However, we do feel that in the sector, in the health sector, one of the biggest successes we've had is on the asset financing. Next slide, please. Additionally to that, this is our customer accounts. Now, depending on what that account will be served for, we have different categories. We have your business accounts, you have your business savings accounts, as well as your Fanikio accounts. This is for the low-end type of institutions. We also provide the investment or NMB Connect. This is for our other distributors, pharmacies, which are depending on where they'll be acquiring sort of services like MSDs and stuff like that. So overall, also finally, we have an investment account such as call account, FDRs and so on, which we do provide competitive rates in case you do need investing. So with that, I do welcome you all to NMB. And those are the features and services that we do provide. And as mentioned earlier, we are available in regionally, but also across the corner, wherever you are. Thank you very much.